Level 0. You're alone, not tied, not gagged, just isolated. No sound, no light, no contact. At first it feels peaceful, but then the silence thickens. You begin to notice your own heartbeat, your breathing. Every tiny motion in your body sounds like thunder in your skull. After hours or days, reality starts to bend. The walls seem to move. You see things that aren't there, hear voices whisper your name. You scream, but there's nothing to echo it back. This is sensory deprivation, not pain through violence, but through absence. Used in solitary confinement, black site cells, and secret experiments, it targets the most fragile system you have, your perception of reality. Your brain is wired for input. Cut off its signals long enough, and it invents its own. Extended solitary confinement is internationally considered a form of psychological torture. Legal limits and oversight can reduce its misuse in prisons. Level 1. You stand in a cold room. Lights buzz overhead. The floor beneath you is hard, maybe wet, and the clock on the wall doesn't exist because you haven't slept in 40 hours, or 60, or 100. This is sleep deprivation, often paired with forced standing, used by authoritarian regimes and modern interrogation units alike. It doesn't leave bruises, but it breaks people. After 2 nights, you forget things. After 4, your immune system crashes. After 6, you hallucinate. Some victims report out-of-body experiences. Others, mental breakdowns that never fully reversed. And it's legal in more places than you'd think. The CIA called it an enhanced interrogation technique. Victims called it something else, hell in the shape of time. International treaties like the UN Convention Against Torture prohibit sleep deprivation as inhumane. Human rights monitoring of detention centers helps enforce these protections. Level 2. You're stripped. Hosed with cold water, the room is refrigerated. The walls sweat frost. You shiver, violently at first, then less. Your body switches into survival mode, redirecting heat to your core. Fingers go numb, teeth clatter, breathing becomes shallow, time crawls. This is cold cell torture, sometimes called frigid exposure. Used in places like Guantanamo, detainees were chained to walls in rooms kept near freezing. Interrogators would douse them every hour with cold water to keep them hypothermic. It doesn't kill, at least not quickly, but it strips you of control. Eventually, victims beg for heat, for pain, for anything that proves they're still alive. Temperature-based torture often leaves no physical evidence. Infrared body monitoring and third-party audits of prison environments can detect and prevent this practice. Level 3. Everything is white. The walls, the lights, the clothes, even your meals. No windows, no color, no sound except your breath and the echo of your own thoughts. This is white torture, a psychological weapon designed for maximum sensory nullification. Reported by political prisoners in Iran, it's meant to erase identity, time, even memory. Without variation or stimulation, your brain starts to fold inward. Victims describe losing the ability to visualize family members. Some forget their names. Others re-emerge from captivity with PTSD that mimics dementia. You weren't hit, you weren't cut, but something was taken. And sometimes, you never get it back. Psychological torture leaves deep scars. Legal definitions must include sensory deprivation and forced monotony to close loopholes used by repressive states. Level 4. You kneel, not for prayer, but for pressure. Your hands are tied behind your back, your knees are bent at a brutal angle, and you're told, don't move. 5 minutes in, your thighs burn. 10 minutes, your spine locks. 20, your blood flow slows. You faint. They slap you awake, and it starts again. This is stress position torture, a favorite of both modern and ancient regimes. From US military black sites to police cells in Myanmar, it's used to inflict pain that isn't permanent, but feels endless. Victims are made to stand spread eagle or crouch in a box position for hours. Muscles tear, nerves inflame, circulation collapses, and every moment feels like the one before death. Clear regulation of interrogation procedures and mandatory surveillance in holding areas can reduce untraceable torture like stress positions. Level 5. You lie back, blindfolded, your wrists are bound, and you hear the slosh of water, cold, steady, rhythmic. A cloth is placed over your face, and then water. It pours into your nose, your mouth, fills your throat. You can't breathe, but you're not drowning. Not yet. This is waterboarding, torture masquerading as simulation, but to your lungs, it's real. Used famously during the Bush-era war on terror, waterboarding induces the same physiological panic as near-death drowning. It can be done repeatedly, leaving no marks. But its effects last far longer. Insomnia, trauma, permanent damage to the sinuses and throat. Victims often confess, not because they're guilty, but because they'll say anything to make it stop. A global legal ban and political accountability are essential. Countries must enforce prosecution of officials who authorize waterboarding. Level 6. You lie on your stomach. Two men hold your legs. A third swings a rod, not at your back, not at your head, but your soles. Strike, strike again. At first it's sharp, then something else. Your nerves begin to fail. Every hit echoes in your teeth. This is falanga, foot whipping. Used in Turkey, Iran, Egypt, and beyond, it targets an area rich with nerve endings and shock receptors. After 30 blows, the pain becomes excruciating. After 50, victims may lose the ability to walk. Some suffer permanent nerve damage, others lose sensation completely. It's a method that disables and humiliates, invisible to outsiders, devastating to the body. Routine medical checks and independent forensic doctors are critical. Bruises on soles fade quickly. Early documentation prevents erasure of evidence. Level 7. You lie flat, arms stretched overhead, ankles restrained. Your body is bound, not by chains but by position. And then the tension begins. No ancient wheel, no medieval winch, just straps. Pulled tight, too tight, across the chest, around the knees, beneath the wrists. You're not being pulled apart by a machine, but by time. This is prolonged restraint, the modern descendant of the rack. Used in interrogation centers, psychiatric wards, and black sites, it's rarely about safety. It's about control. Detainees have been strapped to gurneys for 12 to 24 hours at a time, their bodies locked into positions that strain ligaments and compress nerves. In some cases, they're stretched diagonally across cold metal beds, unable to shift, unable to sleep. The damage doesn't look dramatic, but it's devastating. Shoulders dislocate from prolonged tension, spinal discs herniate, muscles cramp, swell, and tear from immobility. Nerve compression can lead to partial paralysis, not from trauma, but from time. In CIA black site reports, detainees were kept in painful restraint positions until they hallucinated. In some psychiatric institutions, patients have been therapeutically immobilized for days under the guise of compliance. It's not the rack of history books, but it hurts the same. And like the original, it's often followed by a question: are you ready to talk now? Modern restraint must be governed by strict medical ethics, time limits, and oversight. What's framed as control can quickly become untraceable torture. The absence of bruises does not mean the absence of harm. Level 8. You're strapped down, limbs exposed, and someone brings out wires. They don't aim for your head. They aim lower, your fingers, your thighs, your genitals. This is electric torture, more precisely, electroshock. And it doesn't just hurt, it hijacks. A low-voltage pulse causes intense burning, involuntary muscle contractions, and temporary paralysis. At higher settings, your heart stutters, your vision tunnels, you lose control of the bladder and bowel. One jolt can scar for life. Repeat shocks damage nerves and collapse your body's entire signaling network. In Chile under Pinochet, prisoners were strapped to la parrilla, the grill, and shocked for hours. In South Africa's apartheid prisons, electrodes were applied to tongues and gums. Even in modern times, reports of cattle prods used in custody still emerge from authoritarian regimes. The worst part? Electroshock often leaves no external marks, only memories that return with every flicker of light. Mandatory inspections of interrogation sites and electrical equipment bans are essential. Electroshock is silent, invisible, and lethal without safeguards. Level 9. They bring in a doctor. You're told you'll be examined. Instead, they inject something into your veins. At first, it feels like warm honey. Then your muscles begin to fail. You can't speak, can't move, but you feel everything. This is chemical torture, using pharmacological agents to suppress, distort, or weaponize your body. Sodium thiopental, scopolamine, high-dose antipsychotics. Some cause delirium, others create muscle paralysis. Some leave victims conscious but voiceless, locked inside their heads. In Soviet psychiatric hospitals, dissidents were injected with drugs like haloperidol to simulate schizophrenia. They weren't ill, just inconvenient. In more modern cases, suspects have been sedated, interrogated under truth serums, and left unable to recall if they even spoke. But your body remembers the nausea, the shaking, the waking hallucinations. Chemical torture doesn't always leave scars, but it can unravel a mind faster than a scalpel. Medical ethics boards and whistleblower protections are vital. Every prison must be monitored for unauthorized drug administration and forced sedation. Level 10. You're awake, but barely. They feed you, just enough to keep your heart beating, but not enough to keep you. This is starvation, not as consequence, but as strategy. Slow, methodical, cruelly precise. You're not just hungry, you're deteriorating. First, your body consumes fat. Then it turns to muscle, stripping strength from your limbs. Then it moves inward, to organ tissue, bone marrow. Your heart beats slower, your blood thickens, your liver begins to fail, and your brain, your last defense, starts to starve. You forget words, faces, eventually, even pain. Your skin cracks open, your gums bleed. Wounds don't heal because there's no material left to repair with. You don't sleep, you hallucinate, you stop speaking. During World War II, Allied POWs under Japanese control were starved into skeletal husks. Weight loss over 40% wasn't uncommon. Bones protruded, teeth fell out. Survivors described watching fellow inmates just sit down one day and choose never to stand again. In Nazi concentration camps, daily rations dipped under 500 calories, sometimes just a crust of bread and brown water. Children aged years in weeks, and those who collapsed were punished for being weak. But starvation doesn't always look like death. Sometimes it looks like compliance, silence, obedience. Because when you're starving, resistance feels heavier than survival. And this cruelty persists. In modern prisons, starvation can be disguised as policy, meal limitation, administrative restriction, behavioral incentive denial. Water is rationed, calories are cut, and over time, the body begins to consume itself in a war where every cell loses. The damage isn't just physical, it becomes cognitive. Without glucose, the brain misfires. Prisoners report confusion, rage, and memory blackouts. Some lash out, others withdraw, and all of it, the breakdown, the silence, the madness, can happen in plain sight. Starvation is invisible if no one's counting the calories. That's why nutrition logs, weight tracking, independent food audits, and outside medical inspections are critical. Because hunger isn't always a failure of logistics. Sometimes, it's the plan. Level 11. You're dragged into a room that smells like bleach and rust. They don't ask questions. They just cut. Not deep. Not yet. A slice across the forearm, the sole, the thigh. This is mutilation torture, where the goal is to damage, not kill. Fingernails are removed, teeth shattered, ears sliced, genitals maimed, skin peeled. And the worst part? It's slow, designed to draw screams without spilling too much blood. In Sierra Leone's civil war, rebels used mutilation as messaging, hacking limbs to punish traitors. In Syria, detainees reported having bones broken with blunt tools, skin sliced with scalpels, then left untreated. The pain never ends, because the wounds never fully close. Limbs may heal, but sensation returns as burning, stabbing, phantom agony. You don't recover, you adapt. And for some, that's worse. Insight, medical documentation, forensic imaging, and amputee support aid post survivors, but only if torture is recognized, not buried in bureaucracy. Level 12. They don't want your voice, they want silence. so they go for the mind. This isn't pain you can scream through. It's psychological annihilation, not just torture of the body, but of the self. A slow erosion of meaning, memory, and reality. Interrogators weaponize loss. They tell you your family's dead, that your children have turned against you, that your cause collapsed years ago, and no one even remembers your name. They forge newspapers. They hand you letters, handwritten, sealed, that look like they came from home, but they didn't. They're lies, crafted with precision. They show you a video, proof, your wife with another man, your comrades shot for betrayal. They even use actors to become your loved ones, to tell you to your face that you were never worth saving. In North Korean prison camps, detainees were told their cities had been nuked off the map, that they were the only survivors. In Nazi Gestapo cells, some were forced to listen to recordings of children screaming, looped for days. Not just any children, their children. And when your grip on reality starts to slip, they push harder. They show you another prisoner. They say you turned them in. You deny it, so they execute them in front of you. Only, they didn't. It was staged, or maybe not. You'll never know. This is where pain becomes absence, not of the body, but of self. People lose track of time. They forget who they were. They stop eating. They confess to crimes they never imagined. They start whispering to the walls, begging for the end. Because when nothing matters, the mind folds. Psychological torture doesn't end with a rescue. It lingers, in dreams, in silence, in every attempt to feel normal again. Trauma-informed care, truth restoration, and family contact are critical for recovery. With time and support, even a shattered identity can rebuild. But it begins with someone telling the victim, none of it was real, and you're not alone. Level 13. You're naked, shackled, surrounded. They laugh. This is sexual torture, one of the oldest and most taboo methods of control. It's not about desire, it's about domination. It ranges from humiliation, forced nudity, verbal degradation, simulated acts, to direct assault. In Abu Ghraib, detainees were forced to pose in sexual positions, sometimes sodomized with objects, while cameras rolled. In Chile, under Pinochet, female detainees were gang-raped with dogs watching, then threatened with pregnancy from their rapists. For LGBTQ+ detainees in Chechnya, torture often included forced corrective rape and electrocution to genitals. Sexual violence shatters identity, not just of the victim, but of their social world. Some survivors never return home. Others are ostracized by families who blame them. This isn't torture by accident, it's policy, enforced through silence and shame. Confidential survivor reporting, post-assault care, and cultural reintegration are key. Sexual violence must be documented as a war crime, not a secret. Level 14. There's no one holding you. No shackles, no screaming guards, just a decision, your own. Because this is forced complicity, the final, most intimate form of torture. You're ordered to hurt someone else. Sometimes a stranger, sometimes a friend, sometimes your own family. If you refuse, they suffer. If you obey, you suffer. In Argentina's dirty war, prisoners were forced to betray others to avoid beatings. In Cambodia, under the Khmer Rouge, children were made to execute parents. In Iraq, captives were told to beat fellow inmates to avoid genital mutilation. It's the perfect trap. There is no right choice. And even if you survive, the guilt never leaves. You carry it into freedom, into family dinners, into every mirror. They didn't break your body. They made you break yourself. Truth and Reconciliation Commissions must treat forced complicity as victimization, not blame. Survival isn't betrayal. It's evidence. They broke bodies, silenced minds, and bent reality, but history remembers. If this opened your eyes even a little, hit subscribe, because the darkest truths deserve the brightest spotlight. If you could erase one torture method from history forever, which one would you choose and why? Let's see what humanity would undo first.